Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Here with a very special guest, a patient of Caring Medical, a patient of mine, Lisa, who's also an expert on disc assessment. Why don't we first just talk about your medical care,
Okay.
and then you're in the healthcare profession, and tell us like what led you to Caring Medical, like what caused your symptoms, what symptoms, and then why you ended up coming here.
So I'm not in healthcare, but I do a lot of studying about healthcare.
Yeah.
So my symptoms were, well, there was many, but the vertigo, the brain fog, memory loss, trouble swallowing, stomach issues, liver issues. I have a list here. So my ear plugging up, food sensitivity, acid reflux, nausea, shortness of breath, problem swallowing. Balance was terrible. Like my husband had to hold on to me. I couldn't drive. I'm a type A personality, so I have 4 businesses, and I couldn't drive myself anywhere. So he was driving Miss Dizzy.
Oh, driving. Driving Miss Dizzy.
Yeah, so many symptoms that it was just my quality of life had gone down.
For how
quite a
many
bit.
years did you have that? Or
Actually, for about a year and a half before I found you.
and then you went to a bunch of physicians and everything, and they couldn't figure out.
I've been to naturopaths, brain doctors, regular doctors, the whole bit. Nobody
Okay.
ever thought about structural issues.
Okay, and then.
Where
so-
am I now?
Yeah, and then what? And you've had how many how long have you been my client?
Well, I've had 4 treatments. I'm here for my 5th.
Okay.
So after my 3rd treatment, my headaches were 80% improved, sinus pressure 80% improved, blurry vision 80% improved, brain fog 50%, vertigo is almost gone, executive function. So that's what, I can only do so much work during the day. And with the issues with my brain, I could not focus on anything. So I couldn't get much of anything done. But by the time I got here after my 3rd treatment, it had already improved by 50%. So I could work past, say, 2 o'clock in the afternoon,
Okay.
where before 2 o'clock I was done. Ringing in the ears was 50% better, balance 80% better, light and sound sensitivity 70% better, swallowing 30%, memory issues 40%, nausea 70% better, shortness of breath 50% better, fatigue 50%, ringing in the ears better, chronic clearing of the throat's 20% better, food sensitivity is 30% better, acid reflux is about the same.
Now you're into natural health. Were you into healthy eating and stuff prior to all this stuff happening? Or
Yes, so I don't eat gluten, I don't eat much sugar, I don't eat much dairy.
like you were already into health. So even with that, what do you think caused all this? Like like you said, in the last 2 years, it's been like a gradual decline. It
Yeah.
absolutely was progressive. So what do you think?
Well,
like
I've
in
had-
hindsight, what do you
yeah,
think led to it?
On our 2nd date, we got into a car accident where a drunk driver hit us.
Okay.
So I think that was the start of it. I had a head injury at 5 years ago. And then, I look at this a lot. I'm
Okay.
on the computer a lot. And I had COVID. So I think it was just a combination of things.
Okay. Like it might have started years ago. The other thing too, maybe the point is ligament injury. Like that's where people can get into a car accident, but the ligament problem not manifest for years later. Because the body will compensate by muscle tightening. It'll get you in a position where you can function reasonably well. But when the body can't compensate anymore, like it can't stop the movement of the destructive movement of the bones, that's where, it's just gonna, like you're gonna go all of a sudden from mild symptoms to horrible symptoms.
Right.
But the problem could have been going on for years, but the body, tightens the muscles. Like
Yeah.
prior to 2 years before, had you had any neck care? Or did you have tightness in your neck? Or?
I've had tightness in my neck for years. In fact,
Yeah, that's what I
massage
mean.
therapists I wear them out. Like they cannot handle how tight I am. Like I had one person saying, I can't have any other clients after you because it's just too hard to get through the mass. I was seeing myofascial people
Yeah.
who had never seen anybody this tense. Yes, I have had terrible neck issues for years.
Okay. I guess that's like one of the points for people at home. Like it's not normal to wake up and your back hurts, and then you gotta, every month or every week you gotta go to somebody. Like the muscle tension is the body trying to stabilize your neck. So you had
Right.
neck instability for years, and then eventually the muscles wear out. They can't do it anymore. Then vertebrae malrotate. You bend down. You bend down. Then the vertebrae go forward, and then eventually, the vagus nerve starts getting injured, and then you get all kinds of symptoms. So the other thing too is, like you kept saying, after the third visit, after the third visit, after the third visit. Because sometimes what happens, we give the right recommendations to the person, then they may get a prolotherapy treatment, a second prolotherapy treatment, and there's a little bit of help, but the whole process is like the improvement in the neck structure is gradual. So we don't know exactly how much improvement, like say you started out with, a little bit of a reversal of the curve, and say after 2 months you got it down to straight, but that may not be enough to open up your jugular veins or help the vagus flow. But then you keep at it, then you get a little bit of lordosis, and you're like, geez, something changed, like all of a sudden. So was your thing gradual, or was it a major improvement after like the third visit, or was it?
After the third visit was, I think, the most, but after the second visit, I had 10 days of no brain fog, no whatever. So we knew it was structural because the swelling was still there. And then once the swelling went away and the inflammation went away, then my symptoms came back, right? So it was great for about 10 days. And then after the third visit, it was a lot better.
So you're a lot more hopeful.
It was so nice to get my life back.
Good. And then you're traveling again?
Yeah, we just got back from Europe for 3 weeks.
Oh, awesome. It was a good trip.
It was an excellent trip.
And you said you had a daughter there?
We have a daughter in the country of Georgia.
Okay, so you visited her.
She came to visit us.
Okay.
And then we have exchange students all over Europe, so we visit them when we go.
Like, how did you guys end up with exchange students?
Most of them are through the Rotary Exchange program. So Rotary has youth exchange, and we get them for a school year, and they usually go to 3 different host families. And I'm usually the counselor because I'm in Rotary. So I am the counselor for whoever comes in. Like we have a new kid coming pretty soon, I'll be his counselor.
Yeah. Well, I had mentioned you, because the way you speak to me, I always think like you're in healthcare. Now you say, a counselor's, I would consider that healthcare. Now, explain about your expertise as far as counseling, the DISC assessment, and then what are you on the DISC assessment, and then what am I? And if you could just explain that.
So technically, I'm a coach, and so DISC assessment is behavioral styles. So there's 4 main behavioral styles. There's the D, which is the dominant, and that's how we are when we're problem solving. So if you think of someone who's a high D, you're going to think like a Donald Trump. Somebody likes to make fast decisions, sometimes gets himself in trouble by not thinking about the people around him. Someone who's a low D is going to be slower in making decisions. Then you have the I, that's the influencer, and that's how we are when we're around other people. So a high I is very outgoing, likes to use their hands, like somebody else I know here, who is great when going into a room full of strangers. They can make friends almost immediately, right? Where if you're a low I and you go into that same room full of strangers, you're probably going to get a plate of food, stand in the corner, or find somebody else to walk around with because you're not great at those interpersonal relationships in a crowd. Then there's the S, that's the steady. That's how we are when we're planning and working in a team. So someone who's steady likes to think things through. They like to process things. They're really good about making sure that the people around them are happy. And then if you're a low S, you like change. You're more likely to make decisions a little bit quicker, like the high D. The one thing that the high S has to be aware of is that sometimes their need to process things could be seen as a lack of making a decision, like procrastinating. Then there's the C, that's the conscientious. That's how we are when we're dealing with facts and logic and procedures. So the higher you are on the C, the more facts and logic you need, right? So those are our doctors, our airline pilots, our CPAs, or in our business, we own 2 automotive shops. Those are the technicians that you give the really hard wiring diagrams to, because they're willing to follow every step. A low C like me, we hate paperwork. We don't want to deal with procedures. We find people like you who can help us with that. right? So on the scale, you are definitely an IC because you're very outgoing. You like to use your hands a lot. You like to be around other people. And then you've got that technical side as well, right? Where you like to figure out things, and that's why you do what you do, and you do it so well, is you can follow those steps. Where I'm a DIS in that order. So I'm more dominant, about 75% on the scale, and then I'm an I because I'm pretty outgoing, and then I'm an S, which is right above the energy line, and I have almost no C.
Okay. Now explain what the test is. So it's a DISC assessment, because you know we use that. I explained to you like we use that even, yeah. You know, like because you know you can know the strengths and the weaknesses of somebody. So what is it? What is the DISC assessment?
So it's about a 10-minute assessment. The one I do is you get online, you do about a 10-minute assessment, and then
It's questions. They answer questions.
Yep, questions, and it can sometimes be frustrating for people in different behavioral styles. And what we get is a report that tells us is it's about 98% accurate as long as the information going in is accurate, right? So we get a report that tells us not only where they are in the scale, but then we have questions or things that they can go through. So what I do is I go into a business, I assess the staff, I do a debrief with each person, and I have things that I follow through that report. So if it says motivators, it'll give you 5 different answers, and I have them pick 2 that they agree with. And so we'll discuss, okay, one of their motivators is to be in a business that has involvement in the community. And I'm going to use my own business as an example. I was talking to one of my staff members, and that was one of their answers. And I said, so how are we doing there with that? And he said, well, we're doing a great job. I love that we're really involved in the community, but I didn't know we were giving cars to single moms. How come we're not involved in that? Right? So I ended up changing a policy to involve them in that process based on the answers of the assessment. And so that's kind of what I do for my clients. And I find out where the problems are in the business, how happy their staff is, because we know as business owners, if the staff isn't happy, they're more likely to be absent. They're going to make more mistakes. They're higher risk of cancer, heart disease, depression, alcohol use, all of that, if they're not happy at work. So unless we're doing our job, making sure that we're taking care of our staff, then the rest of their life is affected, including their marriage and their children.
So also by a person knowing their DISC assessment, like what they are, it also helps the person understand their strengths and their weaknesses. So then, like for instance, somebody like me, if I'm a IC, what would say be maybe my weaknesses and what could I do about them? Because you know you're ultimately trying to help somebody be the best version of themselves in the context of work, but really it's about life.
Right.
So I'm an IC, so say you were coaching me.
Yeah, well, it would depend on exactly what your DISC assessment said and what you said to me about your weaknesses and what you wanted to work on. So let's say one of your weaknesses was I tend to think it's my way or the highway, which is not you. But let's say that's what somebody says. Okay, how does that hold you back in work? What do your coworkers think about that? Then we would address that and how to work on it. But what we talk about is, let's say as a leader, because we have a leadership assessment, we have a sales assessment, and then just a regular assessment. If you're a leader and you're an I, how do you talk to a D? If one of your staff members is a D, how do you talk to them? So as an I, you might want to give, as an IC especially, you might want to give me this long list of information. As a D, get to the point, and then let's move on. I'm not going to want all of the information, right? So be more succinct in how you communicate with a D. So we go through that with each person that you're working with, and then we actually have something called a side-by-side where we can tell. I had a technician that came from one shop and went to another shop, and he's an SC, and we have a DC. Well, I don't put the SC next to the DC because they would not jive, right? So we think about all of the different behavioral styles, all the different personalities, and then we help them communicate based on what we find.
I was just thinking, like you were saying about, that's a great example. Then I was thinking about the S type. Like I'm just thinking about like a staff member or people that I know that struggle with people pleasing. Like it stifles them. You know, like they're just so worried about doing something wrong because they so much want to do right that it can stifle them. So say you were coaching a business and they had a staff member or several staff members that were very high S's, what would you tell the managers and how to not have the person so stifled?
Right.
Even
Yeah.
though they're compassionate, they're kind, but
Well, the first thing I would start with was the employee and
Yeah.
how to create new neural pathways and change the stinking thinking like we were talking about
Okay.
earlier. And then with the employers, we would talk about, okay, what have they responded to before where that has stopped? And how do we create more of that? Or if they're constant people pleasers, okay, make sure that you are constantly talking to them about they're doing a good job. And then letting them know that you don't have to be perfect. It's okay
okay.
not to be perfect
That's a
here
good
because
point.
we all learn from our mistakes,
That's a
right?
good
We
point.
can't grow if we're always trying to be perfect.
Okay. So you have a private business?
I do. So I do coaching.
Yeah.
Most of the people I coach, I run 2 mastermind and networking groups.
Okay.
So most of my clients come from that or a automotive mastermind group that we are part of. So a lot of my clients come
Well,
from
how would
those.
somebody know to
They
how
can
would
go
they
to-
contact you?
Yeah, CoachLisaMK.com.
Okay, CoachLisaMK.com.
Yep.
Okay. No, thank you for sharing that, and you're ready for your next visit?
I'm ready for number 5.
Okay.